Yeah, so today is bringing our partners together, and it's a celebration of the end of year 2 and what we may or may not have achieved. And with any programme you've got things that work better than other things, but also developing what year 3 will look like.
To really listen to what people say is the most important thing for them actually really gives us the plan for year 3.
I think for me it's about retention, it's about recruiting new staff, and it's about the health and well-being of staff, because we know that people are feeling tired, they're feeling burnt out. So how can we support staff?
To make some connections with groups who might be looking at stats, at measuring impact, and how we can factor volunteering into that.
It's about networking, it's about best practice, it's about new ideas.
After today, I'd like to see the people who've attended today and the wider team saying, OK, that's what I've said, and that's how it's made a difference, and that's how it's informed the strategy moving forward.
I think the progress has been really strong so far. I'm very new to this, but what I've really welcomed is the openness and the integration to accept people from different disciplines to help shape that picture.
I think because the faculty in the system has grown and people know about us now and people get involved and there's a lot more engagement and they can see things changing, then yeah, I've definitely seen people be more engaging.
There's been real progress in people understanding this isn't something that can be done by just working as individual organisations, and recognising that need to work across the piece, that need to work collaboratively. So that real hearts and minds work that's gone on in terms of making people recognise that if we're going to deal with something like placements, which is as complex and as challenging as it is, that we do need to work together to move those things forward.
We've tended to, healthcare is focused on the healthcare elements and healthcare roles, social care the same. Voluntary sectors have historically kind of struggled to get involved and kind of support. The fact that you've got people here from healthcare, from social care, from the voluntary sector, from independent sector providers, all talking about how they can achieve for patients, for our clients, for people that we support. I think that's probably the thing I'm most proud of.
We've suffered through pandemics, we've suffered through governance and structure changes, and we've come through all of that relatively unscathed, and we're there now saying absolutely the only way we'll have success now is by working together, erasing those organisational boundaries and those red lines, and thinking system.
So the game was really interesting. It was about putting yourself in the shoes of different colleagues working within the ICS and looking at challenges from their point of view.
We throw a dice to move ourselves around the board, and then we're challenged with an opportunity or a question or a discussion with colleagues representing the character profile that we've each been given.
What it does is it enables you to put yourself into the shoes of people in roles that might be quite different from roles you've personally experienced, and really gets you to think about some of the assumptions that we make about our workforce.
And really help just to bring home some of the very day-to-day barriers that might be in place in terms of engaging with the system, and also just getting on with your normal work.
It's a cross between Cluedo and Monopoly, really, something like that. But actually it's generated some really interesting discussions around the table, and particularly that different view between health and social care, and yet the people we look after are all the same people. So really fascinating discussions there, yeah. Nobody's flipped the board yet, no.
I think we all enjoyed it. The only thing that was missing was we wanted little people instead of flat counters. I think we very much felt we should have a tiny version of ourselves.
I'm really proud that we had a ton of our greatest challenge. We've got 340 people from across our system helping design and deliver this programme, and that's been no mean feat.
I think it's been really important for colleges like myself to be involved in communities like this, because it helps us shape our curriculum so that we can be certain that the young people and the adults who return to us to be educated have the skills that are required when they join an integrated care service.
We've already put together a bid for over $500,000 to look at improving youth volunteering. We can definitely see examples in the system of where youth volunteering is leading to new people joining the workforce who would never normally be able to join the workforce.
For me, the most exciting thing is apprenticeships. anything we can do to help bring through more younger people, or indeed, people who want to change careers and come into the sector, is really valuable.
We worked really collaboratively with the VCSE sector, with local authorities, with our place-based trusts as well, to put together a group bid.
We've got some really exciting work going on in Hull and East Riding, which is a pilot, connecting with schools and trying to attract young people into careers in health and care. They're the really exciting pieces, I think. We've got lots, though, that underpin the whole programme.
I think there's almost too much to mention, but I think we've made some massive progress in terms of our growing relationship in Kerala and India around ethical international recruitment. We've got some real progress, across the system around education and training. So actually, how do we start to think collectively about the workforce of the future? And actually our combined commitment to the health and well-being of our staff.
I spent 30 years in the healthcare and social care business before I started this job, and I've seen things change for the better over that time. And unlike some people who might feel a bit jaded by going through continuous change, actually I see that as an exciting journey, and I think the next chapter is like a good book. It's really something to look forward to.
Working in healthcare, that we're working on a background of national politics, of government changes, that there are things way outside our control. I think what we should be hopeful about is that we can work as a cohesive ICS to control the things we are in charge of.
That which we can control, we will. So developing our workforce plans, looking at what the future of work looks like, the ability to attract people into careers. We've got fantastic careers in health and care, and we want people to see that and seize that opportunity. So on that basis, yeah, absolutely hopeful.
I am, because it's full of people who've got integrity, who want to make a difference, who work really hard to do that. And there are bumps along the road, aren't there? But this is a group of people who genuinely work across systems and across sectors to try and do that, and they do it really well.
So I think we have a massive opportunity by working together through an integrated way. We have a massive opportunity to really change the way that we think about our future workforce, but also how we think about what health and social care looks like in the future. The only way to do that is in partnership. Not only partnership between organisations, but partnerships with the people who use our services.
I've worked in the NHS for all of my career, and I'm always hopeful about things. I know there are challenges and pressures at the moment, but I can also see some of the great things that we're doing that are making a difference. So I think it's really important that we keep a real focus around those opportunities.
There are ways forward, and there are things we can do better, and things that we can do to improve access, to improve provision for the staff, to improve terms and to improve conditions for staff. And we need to do those, and they will have a positive effect.
Everyone's in the room together and they're talking and they're open to collaborating and improving things. So it's just that next step of making those changes happen now.
When we began this work, we didn't know who was where or how people were connected. The fact that people give of their time because they can see the value in it. Thinking of things like the care at home workforce redesign. We're about to go into year 3 and nothing as yet properly tangible. But the understanding we've got and the framework we've now got for our next steps is incredible, actually.